Hello students, after studying this module, you shall be able to reflect on Murray's life history, identify the cornerstones of Murray's personality, review the idea of needs as motivators of behavior, know about assessments in Murray's theory, and also evaluate Murray's theory of needs. Introduction. Henry Murray designed an approach to personality that includes conscious and unconscious forces, the influence of the past, present, and the future, and the impact of physiological and sociological factors. The influence of Freudian psychoanalysis can be seen in Murray's recognition of the effect on adults' behavior of childhood experiences and his notion of the id, ego, and superego. Although Freud's imprint is clear, Murray gave a unique interpretation to these phenomena. His deviations from orthodox psychoanalysis are so extensive that his system must be classified with the new Freudian rather than the Freudian loyalists. Murray thought that personality psychology ought to focus on the full life course of the individual and was the originator of the label personology for this special disciplinary focus. Two distinct features of Murray's system are a sophisticated approach to human needs and the data source on which he based his theory. His proposed list of needs is still widely used in personality research and assessments in clinical treatment. His data come from normal individuals rather than from the patients undergoing psychotherapy. Also, some of the data were derived from more empirically based laboratory procedures rather than from case histories. Because of his long affiliation with a major university instead of relative isolation in a clinic or private practice, and because of his personal charisma, he gathered and trained a large number of psychologists, many of whom have since achieved prominence and carried on his teachings. Murray's personology, principle of personology. Personality is rooted in the brain, that is, the individual's cerebral physiology guides and governs every aspect of the personality. Everything on which personality depends exists in the brain, including feelings, states, conscious and unconscious memories, beliefs, attitudes, fears, and values. For example, certain drugs can alter the functioning of the brain and therefore the personality. Idea of tension reduction, that is, the process of acting to reduce tension that is satisfying according to Murray rather than attainment of a condition free of all tension. Murray believed that a tension-free existence is itself a source of distress. We need excitement, activity and movement, all of which involves increasing tension, and we need to have the satisfaction of reducing it. Murray believed the ideal state of human nature involves always having a certain level of tension to reduce. An individual's personality continues to develop over time and is constructed of all the events that occur during the course of that person's life. Therefore, the study of a person's past is of great importance. The idea that personality changes and progresses, it is not fixed or static. Murray emphasized the uniqueness of each person while recognizing similarities among all people. As he saw it, an individual human being is like no other person, like some other people, and like every other person. The division of personality. Murray divided personality into three parts, using the Freudian terms id, superego, and ego, but his concepts are not like what Freud had proposed. The id. Like Freud, Murray suggested that id is the repository of all innate impulsive tendencies. As such, it provides energy and direction to behavior and is concerned with motivation. The id contains the primitive, amoral and lustful impulses like Freud described, but in Murray's personology system, the id also encompasses innate impulses that society considers acceptable and desirable. Here we see the influence of Jung's shadow archetype. which has both good and bad aspects. The id contains the tendency to empathy, imitation, and identifications, forms of love other than lustful ones, and the tendency to master one's environment. Further, Murray also contended that the strength or intensity of the id varies among individuals, like one person may possess more intense appetite than another. Therefore, the problem of controlling and directing the id forces is not the same for all people because some people have greater id energy to cope with. Now, the superego. He identified superego as the internalization of the culture's value and norms by which rules we come to evaluate and judge our behavior and that of others. The substance of the superego is imposed on children at a very early age by their parents and other authoritative figures. Murray deviated from Freud's idea by allowing for influences beyond the parent-child interaction by taking into account other factors like one's peer group and the culture's literature and mythology. Further, Murray believed that the superego is not rigidly crystallized by age of 5 as Freud thought but continues to develop throughout life, reflecting the greater complexity and sophistication of our experiences as we grow older. The superego is not in constant conflict with the id as Freud proposed because the id contains good forces as well as bad ones. Good forces do not have to be suppressed. The superego must try to thwart the socially unacceptable impulses, but it also functions to determine whether, where, and how an acceptable need can be expressed and satisfied. While the superego is developing, so is the ego ideal, which provide us with a long-range goal for which to survive. The ego ideals represent what we could become at our best and is the sum of our ambition and aspiration. Now the ego. Ego is the rational governor of the personality. It tries to modify or delay its unacceptable impulses. Murray extended Freud's formulation of the ego by proposing that the ego is the central organizer of behavior. It consciously reasons, decides, and wills the directions of behavior. Thus, the ego is more active in determining behavior than Freud believed. Not merely the servant of the id, the ego consciously plans courses of action. It functions not only to suppress id pleasure but also to foster pleasure by organizing and directing the expression of acceptable id impulses. The ego is also the arbiter between the id and the superego and may favor one over the other. For example, if the ego favors the id, it may direct the personality towards a life of crime. The ego may also integrate these two aspects of the personality so that we want to do is in harmony with what society believes we should do. Opportunity exists in Murray's system for conflict to arise between id and the superego. A strong ego can mediate effectively between the two, but a weak ego leaves the personality a battleground. Unlike Freud, however, Murray did not believe that this conflict was inevitable. Personality development in childhood. Drawing on Freud's work, Murray divided childhood into 5 stages, each characterized by a pleasurable condition that is inevitable, terminated by society's demand. Each stage leaves its mark on our personality in the form of an unconscious complex that directs our later development. According to Murray, everyone experiences these 5 complexes because everyone passes through the same developmental stages. There is nothing abnormal about them except when they are manifested in the extreme, leaving the person fixated at the stage. The personality is then enabled to develop spontaneity and flexibility, a situation that interferes with the formation of the ego and the superego. The stages of childhood and their corresponding complexes are as follows. Stages of development. Claustral stages. Fetus in the womb is secure, serene and dependent. Simple claustral complex, desire to be in small, warm, dark places that are safe and secluded. For example, longing to remain under the blanket instead of getting out of bed in the morning. People with this complex tend to be dependent on others, passive and oriented towards safe, familiar behavior that worked in the past. In support form of claustral complex. Feelings of insecurity and helplessness that causes the person to fear open spaces, falling, drowning, fires, earthquakes, or simply any situation involve novelty and change. Anti-claustral or aggression form of claustral complex. Based on a need to escape from restraining womb-like condition, it includes a fear of suffocation and confinement and manifests itself in a preference for open spaces, fresh air, travel, movement, change and novelty. Now, oral stage and anal stage. Oral stage, oral secretion complex. Combination of mouth activities, passive tendencies and the need to be supported and protected. Behavioral manifestations include sucking, kissing, eating, drinking and a hunger for affection, sympathy, protection and love. Oral aggression complex, oral and aggressive behaviors including biting, spitting, shouting and verbal aggression such as sarcasm. Oral rejection complex, vomiting, being picky about food, eating little, fearing oral contamination such as from kissing, desiring seclusion and avoiding dependence on others. Now, anal stage, anal rejection complex. Preoccupation with defecation and anal humor and feces like materials such as dirt, mud, plaster and clay. Aggression is often part of this complex and is shown in dropping and throwing things, firing guns and setting off explosives. Persons with this complex may be dirty and disorganized. Anal retention complex manifested in accumulating, saving, collecting things and in cleanliness and neatness and orderliness. Next is urethral stage. Unique to Maurice system, urethral complex is associated with excessive ambition, a distorted sense of self-esteem, exhibitionism, bedwetting, sexual craving and self-love. It is sometimes called the Icarus complex after the mythical Greek figure that flew so close to the sun that the wax holding his wings melted. Like Icarus, persons with this complex aim too high and their dreams are shattered by failure. Now, genital or castration stage. Murray disagreed with the Freud's contention that fear of castration is the core of anxiety in adult male. Castration complex is narrower and more literal fashion as a boy's fantasy that his penis might be cut off. Murray believed that such a fear grows out of childhood masturbation and the parental punishment that may have accompanied it. Murray's theory of needs. Needs, the motivator of behavior. Murray's most important contribution to theory and research in personality in his use of the concept of needs to explain the motivation and direction of behavior. He said that the motivation is the crux of the business and motivation always refers to something within the organism. A need involves a physiochemical force in the brain that organize and direct intellectual and perceptual abilities. Needs may rise either from internal processes such as hunger or thirst or from events in the environment. Need arouse a level of tension. The organisms try to reduce this tension by acting to satisfy the needs. Thus, needs energize and direct behavior. They activate behavior in the appropriate direction to satisfy the needs. Now, types of needs. Primary and secondary needs. Primary needs arise from internal body states and includes those needs required for survival as well as such as needs as sex and sentience. Secondary needs arise indirectly from primary needs in a way Murray did not make clear, but they have no specifiable origin within the body. They are called secondary not because they are less important but because they develop after the primary needs. Secondary needs are concerned with emotional satisfaction and include most of the needs on Murray's list. Now, reactive and proactive needs. Reactive needs involve a response to something specific in the environment and are aroused only when the object appears. For example, the harm avoidance need appears only when a threat is present. Proactive needs do not depend upon the presence of a particular object. They are spontaneous needs that elicit appropriate behavior whenever they are aroused, independent of the environment. For example, hungry people look for food to satisfy their need. They do not wait for a stimulus such as a television ad for a hamburger before acting to find food. Now, characteristics of need. Needs differ in terms of the urgency with which they urge behavior. a characteristic Murray called a needs prepotency. For example, if the need for air and water are not satisfied, they come to dominate behavior and taking precedence over all the other needs. Sometimes needs are complementary and can be satisfied by one behavior or a set of behaviors. Murray called this a fusion of need. For instance, by working to acquire fame and wealth, we can satisfy the need for achievement, dominance, and autonomy. The concept of subsidiation refers to a situation in which one need is activated to aid in satisfying another need. For example, to satisfy the affiliation need by being in the company of other people, it may be necessary to act differentially towards them, thus invoking the difference need. In the case, difference need is subsidiary to the affiliation need. Murray recognized that childhood events can affect the development of specific needs and later in life can activate those needs. He called this influence press because an environmental object or event presses or pressures the individuals to act in a certain way. Because of the possibility of interaction between needs and press, Murray introduced the concept of thema. The thema combines personal factors with the environmental factors that pressure or compel the behavior. The thema is formed through early childhood experiences and become a powerful force in determining personality. Largely unconscious, the thema relates needs and presses in a pattern that gives coherence, unity, order, and uniqueness to our behavior. Now, assessment in Murray's theory. Murray's technique for assessing personality differ from those of Freud and the other neo-psychoanalytic theorists. As Murray did not work with emotionally disturbed person, he did not use such standard psychoanalytical technique as free association and dream analysis. For his intensive evaluation of the normal personality, he used a variety of techniques to collect data from 51 male undergraduate students at Harvard University. The research participants were interviewed and given projective tests, objective tests, and questionnaires covering childhood memories, family relations, sexual development, sensory motor learning, ethical standards, goals, and social interaction, and mechanical and artistic abilities. This assessment program was so comprehensive that it took Murray's staff to 28 investigators 6 months to complete. The OSS assessment program. During the World War second years 1949 to 1945, Murray directed the assessment program for the Office of Strategic Service, a forerunner of the CIA. His goal was to select people to serve as spies and saboteurs operating behind enemy lines in hazardous situations. Potential candidates for OSS positions were interviewed and given the Rorschach and the TAT projective tests and questionnaires covering a variety of topics. In addition, candidates participated in situational tests, which are stressful situations that stimulated experiences they could expect to encounter on the job. Their behavior in these tests was closely observed. This pioneering attempt at employee selection through large-scale personality assessment has evolved into the successful assessment center approach widely used in business today to select promising leaders and executives. The OSS program provides a striking example of the practical application of assessment techniques originally intended purely for research. The thematic appreciation test. The assessment technique most often associated with Murray is the thematic appreciation test. The TAT consists of a set of ambiguous pictures depicting simple scenes. The person taking the test is asked to compose a story that describes the people and objects in the picture, including what might have led up to the situation and what the people are thinking and feeling. He derived the TAT, a projective technique, from Freud's defense mechanism of projection. In projection, a person's attribute or projects disturbing impulses onto someone else. In the TAT, the person projects those feelings onto the character in the picture and thereby reveals his or her troubling thoughts to the researcher or therapist. Thus, the TAT is a device for assessing unconscious thoughts, feelings, and fears. Interpreting the responses to the TAT picture is a subjective process. As he admitted in an interview, he referred to the TAT as a kind of booby trap which may catch more embroiled psychologists than patients. The patients reveal parts of himself when he composes a story to explain the picture. Then the psychologist may reveal parts of himself when he composes a formulation to explain the patient's story. In the hands of a trained clinician, the TAT can reveal considerable useful information because of its subjectivity. However, the information obtained should be used to supplement data from more objective methods rather than as the sole mean of diagnosis. Yet, despite the TAT's lack of standardized procedure for administering, scoring and interpreting, as well as its low criterion related validity, the test continued to be used frequently for research, therapy and assessment. Summary: Maurice's childhood was characterized by maternal rejection, adolescence, compensation and depression. The major principle of his work is the dependence of psychological processes on physiological process. Altering the level of need induced tension is a vital to personality. We generate tension to have satisfaction of reducing it. Three basic divisions of personality are id, superego and ego. The id contains primitive amoral impulses as well as tendency to empathy, imitation and identification. The superego is shaped by parents, peer groups and cultural factors, and the ego consciously decides and wills the direction of behavior. Complexes are pattern formed in the 5 childhood stages of development that unconsciously direct adult development. The claustral complex involves a secure existence within the womb. The oral complex involves the sensuous enjoyment of sucking nourishment. The anal complex involves the pleasure resulting from defecation, and the urethral complex involves the pleasure accompanying urination, and the castration complex involves genital pleasure and the fantasy that the penis might be cut off. Needs are physiological based hypothetical constructs that arise from internal process or environmental events. Needs arouse a tension level that must be reduced, though they energize and direct behavior. Need may be primary, arising from internal body processes, or secondary, concern with mental and emotional satisfaction. Proactive needs are spontaneous and do not depend upon environmental objects. Reactive needs involve a response to a specific environmental object. A need's prepotency is its urgency or insistency. The fusion of need refers to needs that can be satisfied by one's behavior or a set of behaviors. Subsidization involves a situation in which one need is activated to aid in the satisfaction of another need. Press refers to the pressure caused by environmental object or childhood event to behave in a certain way. Thema is an amalgamation of personal factors and environmental factors. He had an optimistic view of human nature which is oriented towards the future and grants us the ability to grow and develop. Murray and Morgan developed the TAT based on the Freudian concept of projection. Murray's importance lies in his list of needs and his technique for assessing personality. That's all for this module. Thank you.